So you get pregnant and you share the news.
And that's when all of the advice just starts flying on in.
There is a new study that just came out called the Confusion After Conception Survey. And here to share the results is obstetrician gynecologist Dr. Alyssa Dweck. Welcome. Thank you for being here this afternoon.
Thank you so much for having me.
I think one of the most amazing things out of this is that 38% of women that you surveyed noted that the information provided by their doctor was significantly different from what their mothers were told when they were pregnant. That's really remarkable.
Isn't it? Well, even more remarkable is that 84% of those same women had doubts about their health choices during pregnancy. So to me, this really points towards the fact that we have an onslaught of information coming at us and to our pregnant patients that may be a little bit discrepant. And confusing.
Yeah, very confusing.
You know, you have social media, and likely when you're pregnant, you're probably signing up for one of those sites. Every day they're emailing you about certain things, and the information is conflicting. Sometimes it's might be from the natural community that's, oh, do it all this way, and your doctor has a different advice. How do you discern what you should do?
Well, that's a great question, and of course, my biased opinion is that I think your healthcare provider has the most up-to-date information that relates to your individual pregnancy. So to me, that's the information that you should work off of, and then, of course, empower yourself with other information from books or chat rooms or whatnot, but really you have to have a discerning eye.
Pregnancy can be such an exciting time, but how do you make it not so overwhelming?
Yeah, that's a great question. Well, look, women are changing lots of lifestyle habits in an effort to optimize pregnancy. And of course, it seems their priority is their baby's health. So they change their cleaning products, they change their cosmetics or their skin products, they change their diets and exercise. One thing that I have found in my practice is simple things like a yeast infection, which women will treat typically by themselves. And this survey found that half women were treating yeast infections with a prescription tablet. A recent Canadian study done this year revealed that the risk of miscarriage might be increased with that oral yeast medication, and therefore the CDC and most physicians recommend a 7-day cream to treat yeast rather than this oral tablet. And again, these are the types of things that change over time, where we get evidence-based medicine to help us make smarter choices.
Right. I mean, I'm just thinking, like, back in the day, you know, our moms were all told put the babies to bed on their tummies. I mean, that's just a major thing that now we do completely opposite. So if we have a question.
You're absolutely right. I mean, think about even further years back where women were never told not to smoke or not to drink alcohol. And now those are considered essential no-nos during pregnancy. We've seen changes over time with diet recommendations, with exercise recommendations, and the ones that you're mentioning for baby as well.
Do you find in your practice, like if you do have a question, I think sometimes women are thinking, oh, this isn't worth asking my doctor.
Right.
Would you rather them call you before they just look online?
Great question. Yes, I would rather them call. I would rather them have a list of questions that they bring to the office for their visits. After all, pregnant women are coming in very frequently for visits, so they have ample opportunity to ask. And many practices, including my own, have physician extenders that are very helpful to answer some of the questions that come up over and over for pregnant women.
And this was a pretty extensive survey. I mean, 2,000 women, so you got a pretty good base.
Yes, definitely. We really looked at the span of ages and what differed for women with different ages, which I thought was very, very helpful.
You know, so much of being pregnant is joyful, and the other part is that the new mom, especially if it's their first time, they're constantly worrying. Do you have a final thought on that? Because there's so much information, and it's really hard, I think, for women not to worry.
Yes. Well, look, I think the most accurate and up-to-date information based on one individual person's risk factors and situation is going to come from their own doctor, and then they can enhance that information with outside sources and take everything with a bit of a grain of salt.
Well, thank you so much for your time. We appreciate it. Some good advice just came out.
You're very welcome.